No, I'm saying you won't see it.
No, I don't. We can't see your face either.
Okay, great.
Just your hands
Okay.
and your beautiful ring.
All right. Okay, great. I've never been on camera before. No.
What's your wedding? And your nails are painted.
Oh yeah.
Okay, ready, guys?
Yeah.
All right. So first thing you want to do with the heart, Dr. B wants to make absolute sure that you guys can orientate yourself the right way. You know, she said a lot of smart students get things wrong on the exam because what they think is left is right, what they think is right is left, okay? So what you do is you sap the heart, quote unquote. Sapping the heart means that you look from right to left, the superior vena cava, the aorta, and then the pulmonary trunk. S-A-P, sap from right to left means you got it in the right way, okay? All right. So with that being said, the superior vena cava has two major branches, right and left brachiocephalic veins. This would be your right brachiocephalic vein. Do you guys remember what, makes up that vein? There's two vessels from last unit. Very good. Internal jugular, so this would be your right internal jugular and your right subclavian vein come together like somewhere back here, and they form the brachiocephalic. And then the brachiocephalic joins with the right and left brachiocephalic join and form the superior vena cava. Okay? When we move over to the aorta here, you have three branches coming off of it. The first one is brachiocephalic again, but now this time we're talking about arteries. So the brachiocephalic turns into the right common carotid artery and the right subclavian artery. Now, you don't have the same thing over here. Instead, what you have is you have a direct lead-in to the vessels. So this would be your left common carotid artery and your left subclavian artery. So here you got the brachiocephalic that branches into those two, and with the left side you have a direct lead-in, common carotid and the subclavian artery. Okay? Does that make sense? All right. The pulmonary trunk is next. So the pulmonary trunk is just like the one big vessel coming off from the right ventricle, sending up deoxygenated blood to the lungs, and it's going to branch, the pulmonary trunk is going to branch into the left pulmonary artery and the right pulmonary artery you can see coming out here. So to the lungs, you have one artery per lung. Coming back from the lungs carrying oxygenated blood, you have two veins per lung, okay? All right, and we'll touch on that in just a minute. So here from the outside of the heart again, we want to notice the auricles. The auricles are the ear-like appendages. You have a right auricle and a left auricle. You also have at the bottom of the heart, the pointed tip is called the apex. Even though it's on the bottom side, it's a pointed area, so it's called the apex. Up here, the more flatter surface, where all the major vessels come out, is called the base of the heart. Okay? On the lab, you guys are going to be responsible for knowing the pericardium. Something we can't see here is the protective sac around the heart that will be pinned, okay? Since we discussed the auricles, we'll go ahead and go into the right atrium. It doesn't actually work like this in real life. The auricle is not the opening to the atrium. But if we were to, move the auricle to the side and then cut into the atrium, this is what we would see. So in here, there's a white depression back there. The white depression, which is in the interatrial septum, would have been called foramen ovale in the fetus. That's when you had a hole between your atria as a fetus because you're not oxygenating your own blood, you're not using your own lungs, so blood goes directly from the right to the left side of the heart, okay? Now as an adult, when you are responsible for oxygenating your own blood, they have to close that off so that the blood is forced to go up into the pulmonary circulation. So as an adult, that's going to be called the fossa ovalis. It's a little depression, but it's a closed off foramen that used to be there. Because it is a depression, it has a ridge around the closed off area, and the ridge is called limbus fossa ovalis. Okay? What else do we have here? This is very important. Dr. B wants you guys to know. This vertical muscular ridge is called crista terminalis. And off of crista terminalis, you have these specialty ridge-like muscles called musculi pectinati. Okay? Now, this is a good quiz question. Musculi pectinati are located in the right auricle, right atrium, left auricle, but not the left atrium. Okay? So when you're thinking of like the upper chambers or upper segments of the heart, the atria and the auricles, think there's 4 of them, 2 atria, 2 auricles, but the musculi pectinati is only in 3. It's not in the left atrium, it's got too many other things going on, like 4 veins going into it, so it doesn't have time or space for these muscles, okay? That's how I always think of it. Also, down in here, you guys can see the big red dot there signifies the inferior vena cava. Inferior vena cava. Just anterior to the inferior vena cava, you see another dot that would be number 58. That's the coronary sinus. The coronary sinus on the external portion of the heart is located on the posterior side, right back here, number 27. The purpose of the coronary sinus is to drain the blood from the cardiac veins. So the blood that the heart itself uses to function, you know, the used blood, deoxygenated blood, is carried by the cardiac veins, and they're drained into the coronary sinus. And then it's going to re-enter circulation for oxygenation here in the right atrium. Okay? Then the next thing we're going to look at is that first major heart valve, right down here. That's called the tricuspid or right atrioventricular valve. If we were to follow the blood through that, we're now in the right ventricle. You can see the valve a lot better. You can see the cusp of the valve. You can see the chordae tendineae. And you can see the papillary muscle, which is holding the chordae tendineae to the wall of the ventricle. Now, the papillary muscles are a specialized form of the rest of this musculature called trabeculae carneae. So in the ventricles, this ridge-like muscle is called trabeculae carneae. In 2 of the auricles and 1 of the atrium, it's called musculi pectinati. It's slightly different, but they're still like these ridge-like muscles, okay? Just remember that. Also on the real heart, we're going to see something coming from the septum over, and that's going to be called the moderator band. The moderator band is also called the, hold on one second here. I think it's called the septo-marginal trabecula. And that's going to contain the right branch of the bundle of His. So it's going to give you your impulse to beat, okay, for the right ventricle. But again, we'll see that on a real heart, okay? And it's in the book. There's a picture of the moderator band in bare bones. So then the blood's going to go up through the semilunar valve right here, the pulmonary semilunar. It's important to say that because there's 2 in the heart. So pulmonary semilunar. It's made of 3 cusps. All the valves of the heart are made of 3 cusps with the exception of the bicuspid, and we haven't gotten to it just yet, okay? So blood's going to go up the pulmonary trunk to the right and left arteries respectively, get oxygenated in the heart, and then it's going to come back in 4 veins. So here's the 2 right pulmonary veins, 2 left pulmonary veins. And inside, can you guys see in the atrium, there's four openings, okay? So the left atrium is the thing that's too busy. Essentially those 4 openings, not really demonstrated here, but the 4 openings essentially takes up the gist of the left atrium. We've got 4 major vessels coming in. There's just not a lot of room for much else except for one other opening, which is going to be the bicuspid valve, also known as the mitral valve, also known as the left atrioventricular valve. So you have 4 veins draining into it, and then 1 place for the blood to go, which is through that valve with the 3 names. It's a really common quiz question, right? Like, name this valve. If you say mitral, then it's going to say, give me 2 other names for it. Left atrioventricular and bicuspid. Dr. B made a point of saying that bicuspid is stronger than 3, so that's why this one has 2 cusps. It's stronger that way. And then if we go down into the ventricle here, it's actually just the same as the right. Pretty much it's got the same types of muscles, trabeculae carneae. It's got the same type papillary muscle connected to chordae tendineae. And then the cusp, with the exception of it being 2 instead of 3 on the other side. Okay? When the blood is done there, it goes through, can you guys see the aortic semilunar valve? The aortic semilunar valve, 3 cusps still. Now this one is where it gets a little tricky to explain in words. When it goes through the aortic semilunar cusp into the aorta, right at the level of that valve, if you guys picture the blood, if these are just 2 out of 3 cusps, the blood is going to go up through, and as it comes back down, you know, the cusp, they close and they keep the blood from going retrograde. Now, in these cusps, it's considered like a little pocket, and there's going to be 2 aortic sinuses. Exactly. There's a right aortic sinus and a left aortic sinus. So the blood that's kind of sitting in this region is going to actually be drained into a right or left aortic sinus that's located between the cusp and the wall of the aorta. It's going to drain out, and the right aortic sinus is going to feed the right coronary artery. The left aortic sinus is going to feed the left coronary artery. Okay? Because you want to think the heart is always going to feed itself before it feeds any other organ of the body, right? So with that being said, the right coronary artery comes out between the right auricle and the pulmonary trunk. The left coronary artery comes out between the left auricle and the pulmonary trunk. Okay? So if we follow this right coronary artery, it comes out between the right auricle and pulmonary trunk and then comes down the side, the right side of the heart, gives off a small branch called the marginal branch. Then it's going to continue coursing around the back side of the heart. It's going to give off a branch called the posterior interventricular artery. It's on the posterior surface of the heart. It's between the two ventricles. So posterior ventricular artery. Okay? Then it continues and it's going to anastomose with a branch of the left coronary artery, which we're going to talk about now, so it all comes full circle, okay? Literally, full circle. All right. So the left coronary artery, again, as we said, comes out between the left auricle and the pulmonary trunk. It's very short, and then it branches immediately almost into two major vessels. So the first major vessel comes straight down. It's known as the Widowmaker, not officially, but because it does supply the left ventricle, like directly to the left ventricle. So if you don't have blood supply, you're not going to live very long, okay? And it does kill a lot of people. So the real names for it are the left anterior descending, because it's on from the left coronary artery, it's on the anterior surface, and it's descending. Left anterior descending. The other name for it is the anterior interventricular artery. It'd be just like the opposite of this one we talked about. This was the posterior interventricular, which was a branch of the right coronary artery. The anterior version of it is a branch of the left coronary artery. Okay? The other branch of the left coronary artery is called circumflex, just one name. Comes around the back, and it anastomoses with the right coronary artery. We're almost there, ready guys? All right, we have 3 cardiac veins to discuss, and then we're all done. So cardiac veins, very important that you call them cardiac. If you write coronary, unfortunately it's wrong. Anatomy dictates that it's got to be called cardiac, okay? So you have a great cardiac vein, a middle cardiac vein, and a small cardiac vein. So you can almost think of it as big, middle, small, but the big is better than big, so it's called great, okay? Now, the great cardiac vein basically superimposes the left coronary artery and its branches. So the great cardiac vein follows the LAD and the circumflex. The middle cardiac vein follows the branch of the posterior interventricular artery. And the small cardiac vein goes with the small branch, the marginal branch. So great cardiac vein, think of the arteries from the left coronary artery and its branches. The middle and small cardiac veins are going to be draining the region served by the right coronary artery. That would be the marginal branch and the posterior interventricular. Does that make sense? Okay. I think that was it. Do you guys have any questions?
I don't think so.